Hi, I'm Dr. Debra Houry, Chief Medical Officer and Deputy Director for Program and Science at CDC. Today, we'll be shining a light on the importance of quality of life for people with sickle cell disease. CDC works to improve the lives of people with sickle cell disease through its Sickle Cell Data Collection Program. This program collects health information about people with sickle cell disease to assess trends in diagnosis, treatment, and healthcare access. This information helps inform policy decisions and resource allocation at the state level to improve and extend the lives of people with sickle cell disease across the U.S. CDC also provides online resources for people with sickle cell disease, their family members, and healthcare providers. CDC's data led to the development of several new treatment clinics in geographical areas with the greatest burden of sickle cell disease. I'm joined here today by Harry Williams, a public health analyst at CDC, former professor and sickle cell warrior. Welcome, Harry. Thank you for being here.
Thank you for having me. My name is Harry Williams, and I am a public health analyst at CDC, a former professor, and a sickle cell warrior. Absolutely a pleasure to be here.
Of course. Well, let's jump right in. Harry, tell me a little bit about yourself, including when you were diagnosed with sickle cell disease.
Well, I was born November 11th, 1977, to the parents of Harry and Anita Williams. I was born in the small town of Fort Pierce, Florida, which is about 40 miles north of Palm Beach County. I was diagnosed at the age of 18 months when my babysitter noticed that I was crying and wouldn't stop. So she suggested to my mom that I get checked out medically to see what was going on with me, which my mom did. It was found that I had sickle cell anemia disease through genetic testing. During this time, my parents learned that they had the sickle cell trait, and as a result, I was born with sickle cell disease.
What a really intuitive babysitter. I can't even imagine. And, that's great that your parents, had access to that care and were able to really get that diagnosis. What kinds of challenges did you face then as a child growing up with sickle cell disease? And, how has that changed now for you as an adult?
Well, some of the challenges I faced as a child were frequent absences from school, the inability to engage in youth sports once I hit my teenage years, and the frequent teasing of peers due to the failure to understand that I suffered from a chronic medical condition. Growing up with sickle cell, there was often a stigma that I was a drug seeker due to the high amount of pain medication required to treat me when I experienced a sickle cell crisis. As an adult, medical practitioners often judge me based on my appearance and the normality of my laboratory values. They can't believe that I can be in excruciating pain and not look or appear in severe distress. This leads to a lack of appropriate care promptly, which causes more severe pain that places me at risk for permanent organ damage, stroke, or heart attack from untreated pain. I often have to educate practitioners of treatment that can work to assist me in feeling better quickly. Often this falls on deaf ears.
I'm so sorry you had that experience. I can tell you in the ER, I certainly learned so much from my patients who were living with sickle cell and saw the devastating consequences. You are such an inspiration and a warrior. What has been important in getting you where you are today and in supporting your current quality of life?
I thank you for your words. Partly my faith and my relationship with God has been a very essential in helping me live a quality life. Also having a strong support system in my wife, Rachel, and my mother, Anita Williams, has helped me continue to succeed in life. I also credit having the ability to advocate and educate individuals on the seriousness of living with a severe chronic painful illness has allowed me to connect with allies to help spread the importance of knowing your sickle cell status through genetic testing and counseling so that we can reduce the number of individuals that are born and live with sickle cell disease. Lastly, my long-term hematologist, Dr. Noah Merchant, a Florida cancer specialist, has been instrumental for over 30 plus years in helping me to understand my condition and make life-modifying measures to live a healthy quality life in which I can help make a difference, not only for myself, but others who not have the access or opportunity to use their voices. It's crucial to advocate as we can help affect policies that can help drive equitable distribution and access to healthcare for those who can't afford it or receive it due to the lack of resources.
Thank you. So well said. And sickle cell disease has had such a profound impact on your life. And as you shared, growing up with sickle cell meant experiencing pain crises, spending time in hospitals, modifying sports and activities so you could participate in school. But despite these challenges, you not only survived, but thrived. You learned to manage your health and improve your quality of life by getting adequate rest, staying hydrated, and limiting exposure to pain triggers. In closing, I encourage others to join the fight to protect health and improve quality of life for all people with sickle cell disease. Our collective voice is critical. So please join Harry and all of us in raising awareness and getting involved. Together, we can achieve meaningful change for the sickle cell community. Harry, thank you for making the time to join me for the conversation and sharing your lived experience. Your story continues to inspire and bring awareness to this topic.
Thanks. My pleasure. Always happy to help, and thank you for having me.
Produced by the U.S. Department of Health and Human Services.